myself was that the role of psychotherapy was to put the patient in contact with their conscience, which may be unconscious. In order to have an effective consultation, the therapist needs to come down from the pedestal that he or she is on, created by their position of being the healer rather than the patient, created by their so-called education or status in society. If you're putting yourself above the patient in that way, they will not open up to you. If they feel that you've come down, not come down, but you're just on a level playing field with them, as it were, on a level ground where it is just a conversation between the one who asks and the one who answers, that is the better state. And that is the homeopathic state as well. Not I'm the great doctor, now you just better wear your clean underwear when you come to see me and behave properly, you know. Not that. We're just two people and we're trying to work this thing out together. You have moved seamlessly from the main complaint into the person, the psychological state, the mental state of the person. Yes? So therefore, it's not take responsibility for the unconscious. It is deep inside you. There's a journey that you have to make, and the goal of therapy is to put the person in touch with that. Except in psychotics and schizophrenics and bipolar people, even they also have a conscience, but it can be harder for them. There's a bigger challenge because of the mental illness that they have to put them in touch with the conscience. But there's only one group of people that you can't work with, and what are they? Yeah, who said psychopaths? Yeah, correct, psychopaths. Psychopaths may not have remorse for anything, they may not have that inner ability to do that. We're looking at other ways that we can get information for patients. We were looking at imagery, and we'll be looking at other ways of talking to patients, a provocative process of healing. We'll talk about humor, we'll talk about images, and we'll get you very involved this afternoon. Where this can come in useful, and wouldn't be in the first consultation, if you're stuck, if you feel that you haven't cracked the case, if you haven't got results, you feel that you've spoken a lot and you want to do something different. Okay, so that's where image making may come into the process. Not a primary, it's at a secondary level. But
all the time we're using the metaphor. As an example, if you've got a patient who's in a period of change, a period of transformation, I might invite the client or the patient to make an image of a bridge. And the bridge, you know, that sense of on one side of the bridge is where the patient is, and the other side of the bridge might be where the patient wants to go. If there's a period of change as opposed to transformation, I might invite the patient to make an image of a door. And a door might represent something from the past, the present, the future, something metaphysical. So we work all the time with a metaphor. Obviously, you're not art therapists, you're homeopaths. But I really wanted to, and Brian wanted me to, give you a sense of what it might be like to introduce image making with your client, if you like to get the ball on the road, or to use it when you feel that the client is stuck, maybe. So I'm going to invite you each to make an image of yourselves as a tree. What happens with the tree process? I mean, some of you will have discussed these themes. You have the whole idea about the tree, the rooted tree, what might be buried, what might be around the tree, what might be within the tree, whether there's creatures, whether there's fruits, how strong the branches are, whether they bifurcate, whether they stretch off the page.
There's an answer that if you're banging your head against the wall with the hope of the wall breaking down, the answer isn't necessarily to bang harder and longer. It might be to do something different, okay? So that's what we've been looking at. That's what we're looking at now. Do you remember who David Mundy? You met him, yes? Good teacher. I've known him for many, many years. And he said once he used to, if it was another homeopath, the first question he would ask is, what do you think your remedy is? He says, Merck Sol, okay, Merck Sol, I'll write it down, all right, let's put that aside, and now let's start again, you see? Okay, so get it away. So yes, the loss of innocence, and it's very difficult, and that's why the stuff that we'll be looking at this afternoon is particularly useful in dealing with homeopaths, because we'll use other ways of getting information that aren't the way that the homeopath is necessarily used to, and that you can't easily bypass. You know, the patient who isn't smiling, who looks upset, looks sad, They're not as easy to smile at, but they may be the ones that most need a smile from you.